surgery, and across the room came striding this tall, elegant-looking man, and introduced himself and inquired about my father, who is an orthopedic surgeon and a friend of Charlie's. And in the ensuing years, every time I had a chance to run into him, he's inquired after my father and has been the ultimate gentleman in his interactions. And the ability to take young orthopedic surgeons, make them comfortable in the room, answer their questions, no matter how simplistic, and bring them along, has been, I think, one of Charlie's many strengths and traits. He's changed the way we think about hip surgery. He's changed how we do hip surgery. He's made major contributions through his career, and is a very deserving recipient of this year's Lifetime Achievement Award. I'm going to invite his son Andy to the podium to make a few comments.
Thank you, Dave, for the opportunity to introduce my father, who I've obviously known for many years. This is the man that I know. You guys may not know him like this, but certainly that smile and the relaxed nature are pretty typical. This one was just taken a couple of weeks ago. What you do know is about cementless fixation. He described and reported the results of cementless fixation. This photo is an extremely rare photo of him mixing cement. When he started this journey, really cemented fixation was the gold standard. And he was constantly at odds, trying to figure out a way to prove what he believed was a good alternative. He knew very early on that he really had to do more than simply report on survivorship data, as he did here in 2008. He just knew that wasn't going to be enough. He was never going to catch up with cemented results if he didn't do more than just report on survivorship. So what he did was he collaborated with his colleagues. He collaborated sometimes with people that disagreed with him. And he also collaborated with people that had tools that he didn't have. He also visited his colleagues, and he very closely listened to their concerns and their criticisms. I can't show you all of the pictures of his colleagues that have meant a lot to him over the time. This is a very important slide representing two of the other members that have been recognized as Dad is being recognized today. This was a common kind of setup after meetings. And for those of you that know Larry, this is the way he would typically accost you. And then with Dan and John here more recently. So Dad had to respond to cement, and the way he did it was in an objective, scientific, and honest manner. Those seem like really easy words, but when you're trying to talk about something that is biologic in nature, it is very hard to be objective and scientific, and he did that. So that's what we all know. The other thing that I want to talk about is his fellowship program and a little bit about the research. Over 30 years, he trained over 100 fellows. All of these fellows came to refine their surgical skills. But what they left with was the ability to know and understand patients. A lot of young doctors come and they think all the glory is in the operating room. And to an end, every one of them left thinking about their patients. So we recently had a 30-year reunion, and these are not my own words, these are the words of one of his fellows. And so typically, as you know, you're at the scrub sink in the morning, and your fellow or your assistant has made rounds on your patients. And so this fellow was reporting to Dad that morning about the patients on rounds. And he says, well, Dr. Charles, we called him Dr. Charles because there's also a Dr. Jerry, his brother. Dr. Charles, everybody's doing fine, but Mrs. Jones is really having quite a lot of pain. And so Dad paused and looked at him and the fellow and said, well, did you hold her hand? And the fellow looked back and said, excuse me, Dr. Engh? And as the story goes, Dad said, well, I'm going to go ahead and scrub on this case, and I want you to go back up to that patient's room. I want you to sit down next to her, hold her hand, look her in the eye, and tell her that she's going to be okay. And so I think the reason that my father is being recognized here is his ability to listen to his colleagues, to collaborate with his colleagues, to present objective scientific answers to questions, and for his knowledge of his patients and understanding of his patients. Thank you.
The Society has a plaque that we're going to give for Dr. Engh. I'm going to now turn the podium over to Rob Truesdale.